South African President Cyril Ramaphosa has signed into law a bill that aims to provide universal health coverage. The president on Wednesday hailed the law as a major step towards a more just society, 2 weeks before an election that is expected to be fiercely competitive. Now, Trevor Shaku, National Spokesperson, South African Federation of Trade Union, joins me from Johannesburg. Thank you for joining me, Trevor. Interesting times again in South Africa, but let me know your take on this particular bill that is highly controversial, of course, health bill.
Good evening, and good evening to your viewers. We, as the South African Federation of Trade Unions, welcomed the bill because it is our view that we need a universal health coverage for all the working class people who constitute the greatest number of the poor people in this country. As things stand, we have about 15% of people using private healthcare facilities using medical aid schemes. And as a result, we have 85% of the working class who are using public hospitals. And as a result of the problems which have come out of government's policy, fiscal policy in particular, we have had problems in ensuring that the public hospitals and clinics offer quality healthcare services. So the introduction of the national health insurance, in our view, takes us a step closer to achieving a universal health coverage or a universal health care which is quality, because it would mean that there would be a number of healthcare facilities, including hospitals and clinics, which are pulled into a network of hospitals and clinics, which will be used by the users of the national health insurance who will be registered. And every South African adult and young person will be a member of that particular, will be eligible to be a member of that particular insurance. And as a result, it will, in our view, help in benefiting those people to access quality healthcare at various hospitals and clinics. So we, as the South African Federation of Trade Unions, welcomes it on this basis.
All right. Now, let's take an excerpt of some of the things the president said. In the words of the president, he said the provision of the healthcare in this country is fragmented, unsustainable, and unacceptable. He said at the signing of the ceremony at the Union's building, and he went further to say, that's the president, that for those who would like to see their privileges continuing, sorry, you're on the wrong boat. The boat we are on is about equality. What are the people he was referring to?
Look, he's referring to the 15% that I was talking about, but he's also referring mostly to the medical aid schemes. You see, the owners and the shareholders of the medical aid schemes in the country are making a lot of money out of the pool of people who run away from public hospitals to try to access private healthcare. And they do this, of course, either by going through the health insurances that are offered by private businesses or by going through the medical aid schemes. So there is a 15% of people, like I said, who are who are using private healthcare, especially through medical aid schemes and health insurances that are owned by private companies. So the class of owners of the medical health insurances and the owners of the medical aid schemes are actually the greatest beneficiaries of the two-tier health system that we have, which caters for the rich and caters for the poor. Of course, the public healthcare is the one that caters for the 85% of the poor people in this country, whilst the private healthcare caters for the 15% of the affluent economically class in this particular country. So they are beneficiaries of this particular arrangement in that they make profits out of rendering medical aid schemes to the 15% of the affluent members of our society. But in addition to this, you have the same 14 or 15% of our people actually themselves in getting subsidies from government, because in addition to being able to afford, say, for instance, the medical aid schemes and accessing private healthcare, what is happening is that the 14% of those who are using these medical aid schemes are getting what we call medical aid tax credits. And these medical aid tax credits amount to about 4,300 per annum. And if you were to calculate them by a number of this 14%, it gives you 37 billion per year, which is spent on those medical aid credits, tax credits. In addition to this, you have 51% of the budget to the health department actually spent on the subsidies to the private healthcare, because 277 billion rands in 2023 was used to finance these particular subsidies to the private healthcare. So
Trevor.
in essence, we agree that there is a certain section of our society, both the beneficiaries of private healthcare and those who own private healthcare, who are actually benefiting out of the two-tier healthcare system that we have as a country.
Trevor, sorry, I had to interject a bit, but let's also consider some of the fears of the critics. They feel that the plan would actually drain the already stretched public finances and also limit the choices of patients, and furthermore undermine the quality of healthcare and drive talented doctors out of the country. I mean, is there validity to this, some of these fears?
Look, there's validity to some of the doubts or worries that and concerns that these people have, but they mostly border on hypocrisy, and that hypocrisy is just what I've explained, that they are at the current moment benefiting alone out of the private healthcare, which has become a quality. But of course, what their concerns are based on is a reality. So firstly, the public healthcare is quite stretched and is actually underperforming as a result of government underfunding the public healthcare over time. So over the past 10 years, for instance, the enrollment of staff or the post-establishment of public sector staff in healthcare has actually shrunk. It was not growing and shrunk by 0.1%. And in addition to this, we see that, of course, by the gap that has been opened between the number of public healthcare workers to the ratio of the workers or the population that requires the public healthcare services. So if you look, for instance, at the nurse, you have a ratio of 1 nurse is to 260 population or patients who must be serviced by the public healthcare sector. You have 1 doctor for 2,168. You have 1 a social worker for 5,000 people. So all of these things, which are revealed by the data that comes in line, shows that the public healthcare system is actually underperforming. And of course, you don't need to even wait for the statistics. You just have to hear the cries and the complaints of ordinary members of our communities who, when they go into these clinics and hospitals, they are not assisted adequately. In fact, we even incur unnecessary and preventable deaths as a result of lack of medicine and equipment. We are overstretched in terms of infrastructure. Of course, some xenophobes have actually been blaming this on a number of immigrants who come to our country, especially from the number in Zimbabwe. But that is not true. What actually lies at the heart of it is the problem of lack of expansion of the infrastructure in the public healthcare, lack of the expansion of procurement of equipment. So the concerns of these people are to a certain extent correct, but we are saying that that does not stop
the
national health
issue you have
insurance from coming to
highlighted
be.
is infrastructural deficit, which of course brings me to my question of funding, which quite a number of people are also asking the big question as to how the government intends to fund this particular bill. Are they looking at a situation whereby, taxes would further go up? I mean, what's your take on this?
Sure. So they have actually put in the national health insurance, the funding modalities. They are proposing taxation and all of those. But as the South African Federation of Trade Unions, we have said that we can't overburden the working class with taxation. In other words, we are opposed to taxation that will go into goods, consumer goods, the value-added tax. And we are also opposed to taxation on the incomes of the working people. So what are we calling for as a measure that would raise funds to ensure that NHI is funded? We are calling for a solidarity tax. We're calling for the taxation of the top 1% of the richest people in our country. And we know that that will actually put us in the region between 500 billion to 1 trillion if we were to tax them. Let's say we were to impose a 5% taxation on their wealth. But thirdly, South Africa has a high monetary sovereignty. As a result, it has its own central bank that can monetize the spending obligations of the state. So as a result, we don't think that we have got spending constraints insofar as the fiscus is concerned. The problem of those who are crying about the capacity of the fiscus are those who actually believe in the fiscal neoliberal doctrines that says that a government has to tax and borrow before it can spend. We say that a country with high monetary sovereignty does not have to tax and does not have to borrow before it can spend. It can use the money-creating powers of the central bank to ensure that it monetizes the spending obligations of the state. And that's how we think, in addition to solidarity tax, in addition to the taxing of the rich, the state will be able to fund the NHI.
But do you think, looking at the current economic climate, it would be fair on South Africans who are going through a lot already? Will they be able to, bear this and afford it?
Look, the current economic problems are actually not affecting the rich. If anything, South Africa's economy continues to grow on a daily basis, but a huge share of the surplus is actually taken by the capitalist ruling class, because these are the people who are making profits and who are paying dividends. You can go throughout the South African economy, go from one sector to another, from one industry to another, and tell me which company has made serious losses that it was not able to pay dividends in the last financial year. All of them were able to pay dividends. This is a testimony to the fact that these people should be taxed. So the problems of the economy are not affecting them. They are ameliorated from those particular problems. These problems are affecting the working class. And that is the reason why we are opposed to any income tax on the working people. We are opposed to any tax on consumer prices, such as the value-added tax, and any other form of tax that will impact negatively on the spending capacity of the households of ordinary working class people.
Now, let's look at this move for people within the political space, because we know that South Africa is in the political season, and the ANC, which is the ruling party, is having it really hard. Some are even, speculating that this election might not just be, the usual. Would see it might be a really tight-fist election where, of course, those in the ring would have to really tug it out. Some are of the opinion that this move by the government really isn't out of a place of sincerity, but a political ploy to lure people to vote for the ruling party. Do you think this is the case?
Look, there's a lot of speculation and uncertainty around the outcomes of the upcoming elections, whether the ANC will go beyond beyond 50% of the votes, or it will go below 50%. And of course, even in the context of that, one has to acknowledge that a lot of the efforts they are making at the current moment, including the signing of the National Health Insurance Bill, it is actually an opportunistic signing of the bill in a desperate attempt to try to lure the people to vote for them. So we are not, of course, blind to the fact and realities that the ANC is using all of these things to electioneer. We think that nonetheless, the NHI bill is important. But secondly, whatever the outcomes of the 29th of May, the South African Federation of Trade Unions has no party that it is supporting, so we can't pronounce on any party. Our speculation, of course, can only be limited to the what, on the basis of our own analysis, given the current political landscape, will emerge. Of course, ANC will have a tough time, and indeed, in our view, it should have a tough time. And if anything, it should be taken below 50%, because what ANC has been doing over the years is to listen to big corporations by trying to please them through the risky methods, by implementing fiscal austerity, by implementing some form of restrictive monetary policies, which in the main are actually affecting the working people more than they do to businesses. So the capitalist economy is propped up by the policy measures of the African National Congress, the ruling party. And as a result, we do not have sympathy even if they go below 50%.
Now, Trevor, let's also stay within the election season. What do you anticipate, on a personal note, happening? Because right now we, of course, we have a third force, a second force, will I say the party maybe 5 years, 3 years, 2 years, even a year ago, really wasn't much to talk about. I'm talking about the MK party, and right now it seems to be a major contender in all of this. What do you make of this election as an eventual turnout?
Yeah, no, the truth of the matter is that the upcoming elections will be a watershed. Firstly, to our democracy, but secondly, also in the political economic direction. And like I've said, the African National Congress, the ANC, which has ruled us for 30 years now, has actually just implemented the neoliberal, neocolonial policies of the ruling class globally, where they have allowed a lot of the minerals that are dug from the extractive sector to be flown out of the country to be beneficiated somewhere and turned into manufacturing value-added products there, creating jobs there, creating high-value return there, without actually the country being able to benefit out of that. Secondly, like I've said, they've implemented fiscal austerity, which in the main is the one that has led to the collapse of our health, the declining quality of our basic education, the crisis in higher education, where many of our young people are excluded from pursuing studies because they do not have tuition and even living expense about at the university level. We also have problems of infrastructure collapse where our roads have holes in the middle. We call them potholes. And as a result, are not even being fixed. We have an ESCOM that is ailing. So the African National Congress has over the years merely implemented policies that favor the rich. What we see in the political landscape, and of course, on the electoral platform, the organizations that are going to be contesting, all of them are identical, except for the EFF. The EFF, of course, is presenting a different policy in that it still re-emphasizes the role that the state has to play in growing the economy through industrialization. They're proposing the creation of a state corporation for building of houses. They're proposing a state corporation in infrastructure building. They're proposing actually to insource almost all forms of services and goods, which, of course, at the current moment are being outsourced to private companies. So that is to build state capacity to become a super efficient machine that will help to produce low-cost goods to the people, but at the same time deliver free basic goods to our own people. This is the only party that is actually having a different political and economic program. The rest of the other policies of the rest of the other organizations are merely advocating for the
Trevor,
privatization, that they are emphasizing that it is the private sector that has to create jobs, and that the role of the state merely has to be playing the role of creating an enabling environment. So we think that this is going to be a watershed moment, both politically, testing our own democracy, but secondly, economically, because we need a party that will drive progressive economic policies, not the nonsense we've seen in the past 8 years.
All right. Now, I mean, talking about economic policies and this particular health bill, now there's a ranking here, South Africa's top, health issues. And part of those health issues includes tuberculosis, which, of course, comes up as number one. Then there's diabetes, there's cardiovascular diseases, there's HIV and AIDS, hypertension, and also influenza and pneumonia. Now, my question is this. I mean, this pretty much, this is a list full. How will this health insurance, initiative help reduce these cases? I mean, how much of impact, do you think this particular bill will have, in reducing, incidents of this health nature, such as this?
Look, the bill also envisions pulling together of resources. And one of the key issues in addressing some of the diseases that you've counted or health conditions that you've counted is a matter of education on the part of the public on how we are able to prevent them. And as a result of the fiscal, and you will forgive me because I'll constantly return to the fiscal policy, because that's where the problem actually in our view lies. You see, at the time of COVID-19, the budget for the health department was slashed, and that even affected the ability of health department to be able to drive a communication in educating people about COVID-19. The same thing has applied to pneumonias, your tuberculosis, and many other chronic diseases that belies the health system of our country. And as a result, you are not going to only defeat them by dishing drugs to those who are affected, but also by dishing educational content to the rest of the population on how to take preventionary measures. So we are thinking that the main way and the only way in which the NHI is going to succeed in delivering the optimum outcomes in health services to our people will be, amongst others, ensuring that government spends money into this particular program. Firstly, in ensuring that it expands infrastructure and deals with the infrastructure deficit in the health sector. But secondly, ensuring that it spends on goods such as pharmaceutical goods and medicine. It also spends on hiring as many nurses as possible, doctors, and many other professions that makes the health sector to be functional. But in addition to this, you are going to need educational content and material to be spread throughout. So you are going to need funds to do this. We think that all of these are possible in the context of the NHI. And if government is able to pour money into this program, we're not going to fail. The only time we're going to fail here is when there is corruption that chows and loot money that is meant for programs, when government cuts the spending onto those particular programs.
All right, Trevor, thank you so much. I understand that we are pressed for time, but deeply appreciate your time on the program. Trevor Shaku, National Spokesperson, South African Federation of Trade Unions from Johannesburg. Thank you once again.
Thank you very much.